The advice and opinions expressed by Dr. Grant-Pichet and her guests are meant solely as suggestion and should not be in any way construed as child-specific advice.
Dr. Doreen Grant-Pichet is the
Dr. Doreen is an expert in autism.
Doreen Grant-Pichet.
Dr. Grant-Pichet.
Dr. Doreen Grant-Pichet.
Dr. Doreen Grant-Pichet is a visionary in the field of autism. Now you can ask her questions on Ask Dr. Doreen. Good morning and welcome to Ask Dr. Doreen. I'm Shannon Penrod, and look who's here with us, Dr. Grant-Pichet. Good morning.
Good morning, Shannon. Good morning, everyone. Nice to be here.
So thrilled to have you here. We're really excited to be here and be live this morning. We were going to be with you guys last week. All kinds of things happened. We had a flood in the studio. I got sick. I mean, it's like if locusts come, I'm going to get worried. You know what I'm saying? But we're here, and that's the name of the game, right? We manage to be here all the time, and thrilled to have you with us, Dr. Grant-Pichet. If you guys don't know, Dr. Grant-Pichet is a true expert in the field of autism. I believe the preeminent expert in the field of autism in our time, and she has been working in this field for more than 45 years. I know. It's like, what is the skin cream she is using? Because that doesn't seem possible. But she has been, and thank goodness for so many of us, myself included, because she's made a tremendous difference in so many lives, both of those people on the spectrum and the people who love them, right? And I count myself in that category. Somebody who loves people on the spectrum, one person in particular who, thank God and thank Dr. Grant-Pichet, has been helped through her work, and I'm forever grateful for that. You guys are watching us live, and you are able to interact with Dr. Grant-Pichet live right now on Facebook, YouTube, and Twitter. Our wonderful Chris Desmond, who's working so hard today and doing such a good job, he's going to show you on the screen some of the different ways that you guys can connect. While he does that, I'll remind you guys that this show is live. We do this on Tuesday mornings from 10 to 11 Pacific time, and you can tune in live and catch Dr. Grant-Pichet live. Or you can watch the show on YouTube. We're in our 14th year now of doing these shows together, Dr. Grant-Pichet and I. Me, sitting here kind of, like charting courses, but her really being the person who's doing the heavy lifting, right? In the 14th year. So there is a library that is all free to you on YouTube. But we also want to recognize that the massive portion of our audience listens on podcast, that you take us to go, and that's where you're able to hear your questions from Dr. Grant-Pichet. You can always be writing in questions wherever you are. We're starting this morning with a bunch of questions that you guys have written in, whether you wrote to askdrdoreen.com or you wrote in to me, Shannon, at autism-live.com. We love getting your questions, and you can also and I have it sitting over here. I've been ignoring it. We've already got a ton of people on, Dr. Grant-Pichet. I want to say hi to Andrea. I want to say hi to Esther, Susie B. The Center for Autism and Related Disorders is saying good morning. Good morning to them as well. And Rodney is here with us. Those people are watching us live, and we'll get to some of their questions in just a second. We also have a bunch of questions that I said got written in. But we're so thrilled to have you guys listening, watching, however you do it. Please remember to like, share, to subscribe, to review, because that's how our message gets out to more people. If you have found it invaluable over the last 13 and a half years to hear from Dr. Grant-Pichet, please make sure you share this feed. It is its own podcast now. So we want to make sure that you guys share this feed. So you can do that on whatever platform you're listening or subscribe. It all helps us. Okay. Anything that you want to say before we get started, Dr. Grant-Pichet?
No, I'm all good to go. I'm sorry that I'm not there in studio with you, but happy to be on the show with you.
We're thrilled that you're here. I'm kind of thrilled so that I don't spread. I think I'm past contagious, but I want you to be safe. Anyway, our topic today was what do you do when you don't agree with a diagnosis that you did or didn't get when you went to the doctor. We had some people write in about that, but we have so many questions about so many things. But this first question, this is a gentleman who wrote in, and he's been waiting a couple of weeks for an answer. He says, my ADHD was missed because I was well behaved in school, intelligent and driven. I was only given medication, but if I was only given medication, I would have gotten a first-class degree or close with treated ADHD. Instead, this gentleman reports that he's 45, not married, no children, self-employed. He reports that he is a landlord and owns property, but says the system failed me from the age of 9. That I do casual work, but getting meaningful employment will be very difficult because of where he is. He says that he believes that the problem is worse in adulthood, especially for people who are undiagnosed, and wants to know what your thoughts are.
I mean, that's a really very, very profound and interesting issue to bring up. And I think I would agree. I mean, I think that I see, Shannon, people who have lost opportunities because they were not diagnosed and treated, especially in ADHD, to be honest. I probably have seen more of that than in autism, although very, very mild autism, the same stuff would apply. I think with ADHD, there was a phase, and this gentleman is 45, and it probably hit his youth. There was a phase where, and that would be like maybe 30 years ago, where people were very hesitant to give the diagnosis of ADHD. And I think it was because right before that, everyone was being diagnosed with ADHD. Like as soon as a teacher had an issue in class, the teacher would label the child, oh, I think this child has hyperactivity. And then so ADHD just started to increase in terms of fake diagnosis or false diagnosis. And then it followed with a period of time where it became very hard to get the diagnosis of ADHD. And there were also, I do want to say, there were a lot of young people who were kind of pretending to have the diagnosis so that they could get the medications, because the medications are stimulants. And even to this day, I mean, right now, actually, there's a massive worldwide shortage of the medications for ADHD, which is also fascinating to me. But essentially, there are these kind of political things going on in the world where people who really had ADHD were not getting diagnosed. And if you don't get the right diagnosis, the right doors don't open for you, right? I know people who would have been much more successful at whatever they were doing. In fact, I know people where I am amazed, and I look back and I think, like, how did this individual even make it through school or college? Because of how hyperactive and distracted they are. At the same time, they're used to it, I guess I would say, and they're kind of like struggling but surviving and not necessarily thriving. And I guess that would also apply to autism in some ways, because we do have, and the whole arena with autism is changing, and people have a different feeling towards getting help for autism. So I think it's really timely, and I appreciate this gentleman writing in, because it just goes to something that I feel very, very strongly about, which is no matter what is going on with us, if there's something in the world that can help us do better and thrive, then I think we should all be very receptive and actually even happy to receive that. I feel bad that this has happened to this gentleman, but I'm also want to point out that it's very self-aware of him to bring this up at this point. And I'm sure, no matter what age you are, getting help, I think, will just help you from here on, I guess.
Absolutely. Absolutely. And thank you for writing in. We've got a bunch of different questions. I want to get to a couple that are online. Andrea has written in and said, my 4-year-old has had a switch with therapists. Ever since the switch, he cries when the new RBT comes to get him. He will not eat or use the bathroom the entire 5 hours this RBT is with him. How long should I wait before asking for a new RBT or something to be done about this? He used to love going to the center. He is fine with everyone else, but just not this particular RBT, and thank you.
Yeah, oh my gosh. That must be so disturbing for a parent to see something like that. I would act now. I would act now. I always say, take parents need to you as a parent, we have this kind of intuition or instinctual feeling about our kids, and it's a very good observation that the child is not having a good time with this individual. And if it was possible, I would want to videotape the session that is going on with this one person, just to see, because I mean, clearly it sounds like the session is at a center. So that's good in terms of not worrying about the child's safety. But I would still want to see what this person is doing differently. It's not always a bad thing, but you'd still want to see what's different, right? So, as an example, I mean, there's multiple things that could be happening here. So here's some examples. First of all, our kids do bond with their team members, right? So it is entirely possible that your child is just missing the old RBT and hasn't acclimated to the new person yet. I don't know what period of time has passed. So that's one thing. The second thing is the new RBT could be not reinforcing as much, which is something that can easily be changed. And that means that the new RBT needs to be prompting, modeling more, reinforcing more, doing what the other person used to do or the rest of the team members do, just making it as fun as they did. The third possibility is that the new RBT is actually pushing harder, which is not a bad thing. It's a good thing. But, everyone on the team then should be consistent and sit with each other and say, hey, we need to be probably like, rewarding more, pushing more, doing, like the consistency on the team is very, very important. And maybe the new RBT is going to be teaching more stuff, but maybe they need to slow down a little bit. Whenever you push more or have more demands, you also need to increase reinforcers more. So maybe, and that's something very common that doesn't happen, is people just a child might master something at one level and you get used to that. And then you start introducing new material and you don't realize, oh, it's new material, I need to reward more. So you want to observe and see all of these things. If they don't allow you to observe, or if they have policies against it because he's in a center with other children, then I think you need to pull the behavior analyst in and say, hey, there's something going on different here. I need you to run an IOA session. IOA is just inter-observer reliability, which is essentially, it just means everybody is doing the same thing. It's consistent. So, that's essentially what happens, is we need to find out why your child is not doing well with this one individual.
And I gotta say, from a parent perspective, I love this question. I love that you're weighing the question, because I have certainly seen, and I have been a parent before, where if somebody comes in and your child isn't immediately comfortable on the first day, the instinct is this is not the right person, right? I have seen, I've had parents call me and say, we'd like to take so-and-so off the team. And when you ask why, I have heard every reason under the sun. They dye their hair every other week. I have heard that. Her hair was black last week. She came in and it's blonde this week. And my daughter cried because she changed her hair color. And and I was able to have a conversation with that mom about, okay, so what are we saying? Are we saying that when she goes to first grade and the teacher dyes her hair or gets pregnant and has to leave and the substitute comes in and has different hair color, that she's not going to be able to finish first grade? And we were able to kind of pare it down and go, okay, why don't we work on this? This is something that but not ignore it. Why don't we work on this and help her to get to the point where she's comfortable regardless of what somebody's hair color is? I have been on the team when a parent said, I want to fire this therapist because she shampoos her hair with something that's strawberry scented and we don't like it, right?
Yeah.
I mean, I've heard everything that there is to hear, right? And sometimes it's a real issue. Where it's like, this is making us uncomfortable and we have to deal with it. Sometimes it is a personal issue with the parent. And I think that it's very important as parents that we kind of put it through that little filter and go, is this me or my kid? Which one of us is uncomfortable? Because if it's me that's uncomfortable, can I expand my world? But if it's my kid that's uncomfortable, how long are they uncomfortable for? Because we don't want our kids to be uncomfortable but we want them to grow, right?
Yes.
So
Yes.
hard thing. But I also love your response, Dr. Grant-Pichet, because you need to bring it up. You need to bring it up.
Definitely do.
Because we're not just going to leave this child to be uncomfortable. And I hear mom saying he used to love it and he's not so much. And Dr. Grant-Pichet gave you some really good tips to go in and talk to your BCBA so that you can get this figured out. Because we want him to love the center wherever he is, right?
Yeah, and this is where my quotes that you love having to do with everything in ABA has to be fair.
Yep.
This is where that comes in. So clearly something is not fair right now. Either there's too much demand, not enough reinforcer, whatever it might be, but they can work on that. And the more we teach our kids to be able to manage the world, even if they're not in love with the people in that world, the stronger we're making them, really.
Absolutely. But it has to be fair. I said yesterday I want to get T-shirts made that say, Dr. Doreen says it has to be fair. We had a question that came in, a couple that Marina wants to make sure that I get to. This parent wrote in and said, we're relatively new to ABA, 6 months in. What do you think is the role of the supervisor in ABA? We have a team of 4 BCBAs at home, 30 hours, no BTs. However, there is a managing BCBA that sets the programming and does parent training based on data and feedback from the therapists, who I'm assuming are the other 3 BCBAs. My concern is the supervising BCBA never sees my son in person, only once at intake. Is this usual that the supervising BCBA doesn't see him in person? I feel like a lot of the nonverbal communication issues are hard to convey without seeing a person. Also, the therapists don't have team meetings to discuss my son together, what's working and what isn't for them. It seems like that would be so helpful. Is that typical? The supervising BCBA has always said the outcome is dependent on how fast he moves through the programs. This makes sense. Also, how do I quantify this? I see his graph from the data weekly, but there is nothing more that I can request. The therapists are all telling me he's moving through goals quickly, and hopefully this continues, but I wish there was something to benchmark his progress against. And then there's one more, they apologize for so many questions, but I love them. Are there any more studies or updated data that you can share to show similar to the Lovas study? As mentioned before, we are at 30 hours, but I would like to increase to 40 hours. My husband will need some convincing, so it would be helpful if there is more data to show them. And they say, sorry for the numerous questions. I greatly appreciate all the time and love you put into your show. I stumbled upon it a few days ago and listened for hours already. Thank you. So I will just say about the studies, and then you can say this, Dr. Grant-Pichet. I keep a thing of 6 studies on my computer for whenever parents ask for studies that are like, and they're aging now. None of them are brand new, but they're like the 6. I call them the 6 seminal, because pretty much if you're going to court or talking to a parent, each one of them covers something. So if somebody needs those, just write to me, write to me at shannon@autism-live.com, and I can send those to anybody. But go ahead, Dr. Grant-Pichet. What do you want to answer first?
Sure.
The thing about the BCBAs?
Oh my gosh, there's so much to answer, and this is such a very awesome question from a parent who very clearly gets it. So thank you for joining us, and thank you for your kind words about our show. It's meaningful that when we're able to help. There's a lot of things about your program that don't sound normal. Let's start with the fact that you have BCBAs doing therapy. So the BCBAs are kind of like doctors in the field of ABA, right? So they're the ones that have been trained to mainly they have learned how to design programs to change behavior, both positive and negative behavior. So they are not trained to do therapy. I mean, at least I'll tell you that at CARD, one of the things that we are doing is we're trying to get our BCBAs to do more therapy just so they stay involved with the child. But generally speaking, in any program, a BCBA will come in, they'll do the intake, after the intake, they will do kind of a assessment of the child and in all environments, and whether that's based on observations of the BTs, the behavior technicians, or their own observations in different environments. They'll do all of that. They'll make a kind of a assessment of the child, and a lot of times the assessment has to do with what the child's capabilities are in the beginning when they first meet the child. Now they'll be using different types of curricula out there. So we at CARD use a what I consider to be extremely sophisticated and very highly developed curriculum that we worked on for many, many years called Skills. And that does start with an assessment of exactly where your child is on every different functioning level. So where they are in language, adaptive skills, cognitive skills, etc. And then that is kind of your child's baseline, and then we add from there to try to get them to their goal, and their goal is always going to be their chronological age level. So this is where they start, is where they are now, where they hopefully end up is what other kids their age are doing, right? And that's our goal. So with other people, they're using lots of different things that are out there, like the VB map or WebAbles or other things that are out there, and you should ask what curriculum they're using. And every curriculum generally should have a output. So in other words, ours is kind of what are other kids this age doing? And others might have, like, these are the series of lessons we want to teach the child for whatever reason they're based on, whatever they're validated for. But they should be able to show you, this is what we want to teach, and this is how your child's progressing towards that, right? So what you're seeing is how your child's progressing. Those are the graphs, but you don't know what the overall universe is. And that's very, very important. Shannon, I remember you telling me, like, one of the things that Skills provides that's extremely valuable to parents is, like, it's kind of, you compared it, I think, to the directory in a mall,
Yeah.
right? And it's like, these are all the places I have to go. These are all the things I have to do. Now, how do I get to each one?
Well, where am I? Where am I to start?
Where am
I
I?
want to see
And I
that
think-
you are here.
Yeah, and that's exactly where what the parent is asking is, like, where is my child in the universe of other kids, right? And in contrast to other kids. So it is unusual to have 4 BCBAs. That just doesn't happen because BCBAs are supposed to be designing programs, and they're the ones that are supposed to be supervising programs. So I don't know what agency you're at where they are only using BCBAs. I guess some people would say that's higher quality, but in my mind, it's a little odd, to be honest, because it's like using 5 doctors, and doctors are not always as good as nurses at certain activities, you know? So I think you definitely need one doctor to be running the show. That's the other thing. You don't want, like, multiple cooks in the kitchen either. And there's going to be confusion on what should happen next. So typical programs, you'll have one BCBA who's in charge, and you'll have a team of RBTs, registered behavior technicians. And the BCBAs are master's or doctoral level, and the RBTs are bachelor's level. Or lower than bachelor's, actually. You don't need a bachelor's in order to have an RBT certification, but you do need training. Now, the team, in terms of how the logistics work, if you have, how many therapists did she say she has, Shannon?
It says
I
it's
think
a
she said-
team of 4,
And it's
and
30
no
something hours,
BTs for 30 hours.
Yeah, I mean, that's a really good ratio. I would expect even more than four, but if you have four people doing 30 hours, that's pretty good. I mean, that's really good. It's usually you'll have, maybe five or six people even on a case doing 30 to 40 hours. So that's one thing. The second thing is whoever is the supervising BCBA needs to have ongoing contact with your child and with the others. So they cannot rely on just reports. They need to have, they need to see your child. This is, okay, so in the old days, we used to have the luxury of doing something called clinic meetings. Clinic meetings are when the entire team gets together with the child and the parents, and you all meet, and every individual demonstrates what they're doing, and so on and so forth, right? And so the supervising person can say, oh, this is good, this is bad, let's change that. The child is struggling with this, he's doing really great, you're not rewarding enough, whatever. The whole gamut of feedback that you want to give your team. Unfortunately, health insurance does not allow that. Health insurance will not allow four or five people with the same credentials to be present with a patient at the same time, which is kind of ridiculous. They allow it only in certain situations, like a surgeon and an anesthesiologist, obviously, but not with us, not with ABA. So what has to happen is they do allow one BCBA overlapping with one behavior technician, not with another BCBA, but with a behavior tech. So what happens is normally what we have to do is the BCBA has to do 1 hour with behavior tech 1 hour with behavior tech 2, 1 hour with behavior tech 3 over the course of the week. That way, the BCBA gets to see the child multiple times and is hopefully working on trying to keep all of the team consistent with each other. So, and it's an unfortunate thing. I still strongly believe that if they allowed clinics, it would be cheaper for them and it would be more beneficial to the client, much more beneficial. But we were not able to get them to understand that, payers, the insurance world. So that is something, if you're paying privately, which I honestly have no idea how this organization is providing you for BCBAs. I don't know, that's kind of an unusual situation. Anyway, so whoever is in charge needs to be constantly talking with you and constantly talking to the behavior techs and moving the program forward. I don't know how that's possible without seeing your child on a regular basis. And the other question I was saying is like, they should be able to offer you some guidelines or some visuals in terms of where your child is actually headed. What are the goals? You need to know the goals, not just the progress. You need to ask them, what are the goals here? And if you are still not content with that, or if they're not able to respond to you, I would ask them to give you all the assessments that they need to do every 6 months, because health insurance does require certain tests be done every 6 months. One of those tests is the Vineland. You might be answering questions for them on the Vineland. It's not as good as a test that they would administer to your child directly, but nevertheless, it is some form of tracking how your child is improving in different areas. So that's kind of what you want. You want to talk to the lead supervisor and say, hey, how are you programming my child? If you're not seeing him, I need you to have more contact. Secondly, I need to know what the goals are so that when you guys show me progress, I know whether we are reaching the goals or not. And if you've done any assessments, please send those to me as well.
Yeah, hopefully we got to enough of your questions there, but it's highly irregular the way that your ABA is working. And we got a bunch more questions here. I want to get to Esther. Esther says, hi, my 4.5-year-old with ASD wakes up in the middle of the night and comes to our bed. This has become an issue now that we have a newborn who is also in our room and wakes up our 4-year-old when he wakes up to eat. Usually our 4-year-old would go back to sleep, but now he's staying up. What do we do? Ideally, we would want him to stay in his bed all night, but how? I want to mention that we have to rock him to sleep every night, which probably isn't the best thing either. We would appreciate any advice. Sincerely, very sleep-deprived parents. Well, we're giving you hugs, Esther, and congratulations on the new baby. It's a pretty pivotal time in this 4-year-old's life that he's got a new sibling. And I think, correct me if I'm wrong, that Esther, I don't know, was this the same child that last week we were having a break in the potty training? It might be a different child, I don't remember, 2 weeks ago. But Dr. Grant-Pichet, what do we want to do about this bedtime ritual?
Yeah. Sleep is so underrated. I mean, to me, it's like honestly the biggest thing, the most important thing. And parents are often so sleep deprived, and it's almost like nobody, and the children are sleep deprived, and it's just not, it's overlooked. And to me, it's one of the most significant factors in how our kids do overall. So let me just start by saying I'm with you. I completely agree and understand that this is a situation that needs to be dealt with. Now, the question is how to deal with it. And unfortunately, you kind of have your hands tied now with the baby. And so there's no, I mean, realistically, you can't be the one doing this intervention right now because it's enough that you're dealing with the baby. So I will start by saying you need to find an additional resource. And that's either going to be your spouse, if it's possible, or someone else, a sister, a cousin. If not that, get in touch. And I don't know where you are, but like in many states, like in California, you go to the regional centers, which represent the Department of Developmental Services, and you basically say, I need help with sleep issues. I need kind of a person who's either an in-home respite or somebody who can help me. Alternatively, you hire someone who can just do this as a short-term program. But what it is a combination of things. Your 4-year-old has gotten used to, being with you. And so this is a tough time. This is a very, very tough time, as Shannon said, because now they're already being deprived of some of your attention because of the baby. So some of this has to do with just the fact that they're now having to learn to share attention. The other part of it is just that it's a routine that has changed. So, there's probably noise in the room or there's something else going on with the baby that continues to keep the child up. It is not good for the child. It is not good for you. I think we all agree on that. That's why I was suggesting that it would be great if you and your spouse could separate for a little period of time into 2 rooms, and one of you deals with the baby, one of you deals with the 4-year-old. And I know that often that doesn't happen, but I think this is probably your best bet right now. And then whoever is with the 4-year-old, and you could switch off, right, and rotate, but whoever is with the 4-year-old needs to actively start fading themselves out of the 4-year-old's room. And I've talked about that a few times, that it becomes very problematic. And this is a great example of a time when it is problematic. But essentially, I don't know about the rocking. You can get a rocking chair for your child, put your child in the rocking chair. Rocking is a calming activity. I will say that. It does activate the parasympathetic nervous system, and it does make us a little bit more tired. You can certainly talk to your physician and also get help for things like melatonin or something that might help your child fall asleep faster. Make sure that their room is conducive to healthy sleep. And essentially, the child will go to sleep. Let's say they will rock in their rocking chair, then go to their bed and sleep. And then if they wake up in the middle of the night, the parent, whichever parent, is there to calm them and let them go back to sleep. And a lot of times parents will tell me, yeah, but my child needs to kind of have contact with me, physical contact, because they're next to me in our bed. And what I say is, okay, I'm sorry to tell you, but put a cot or something in your child's room so that you're next to your child, but not necessarily in their bed, and that you can gradually, over the course of a month, distance your cot from the child. You're still there, but you're a little bit further, a little bit further. Every once in a while, you're increasing the distance, and you get to a point where you can actually start exiting the child's room. You do need to do this. Now, it's not something that you can avoid doing at this point. And let me tell you, if you don't do this now, it's going to get harder when your child is school age. It's going to get harder when your child is, when both kids are school. I mean, it just becomes crazy. So the sooner you do this, the better. And yeah, it's a little bit difficult. So be strong, because, this is not a fun, our kids, it's one of those things where we're teaching our kids things that later in life are beneficial to them, right? It's right now, it's going to appear very difficult for your child, and they might scream and tantrum and cry. But in the long run, it's better for them because they will stay asleep, and they'll get more sleep. And that's important for their brain development. So I don't know of any ABA organizations that actually will come to your house and do this. There might be, you might ask for help with this, because it is a process. But if they don't, they certainly will guide you and provide a lot of training to you on how to shape this behavior, because it is a very kind of regimented step-by-step type of program where you're gradually fading yourself out of the child's room. And that's the only thing I can think of right now, because it really does, the harder part, the part of doing it is not that hard. I mean, it's hard. It's hard. It's emotionally difficult for us as parents, but the harder thing is, having a spouse and deciding you're going to deal with one child, I'm going to deal with the other. That's the only way you're going to get this done. You cannot deal with both of them in the same room at this point.
There we go.
It's
Great
hard.
advice. And
Just
she
tough, real life difficult situations, Shannon,
absolutely. And yes, she is in Los Angeles. I meant to tell you that too. But she wants to know, do you think getting a sleep consultant is a good idea?
There's no harm in getting a sleep consultant. I don't know what they do. But there's no harm in getting all kinds of assessments to figure out, like, is there something else going on with my child not sleeping? But I'll be honest and tell you, it's a very basic thing. When we remain in the bed with our parents, we're getting some reinforcers that we don't get in our own room. Especially if I wake up and somebody gives me even a glass of water or milk or something, then I'm definitely going to be waking up on that schedule. That's how our bodies work. We do have a schedule. So yeah, feel free to get a sleep consultant. I would also really recommend that you get a BCBA or someone to consult with you on a program to help get away from these issues.
There we go. We're waving to Nicholas. We're so glad that you're here. And Judy, thank you so much. She says, great topics. Loving hearing from Dr. Doreen and Shannon's advice with our troubled issues. Happy Valentine's Day to you both. Happy Valentine's to you as well. Shradhanjali, and I forgive me if I've slaughtered your name, says, hi, my 10-year-old goes to 5th grade inclusive classroom and struggles to forget things at school like lunchbox, jackets. Secondly, he struggles on language comprehension in ELAR, and he is currently at CARD.
So this is great. And how old is he? 10?
10, yes.
So this is okay. So I have lots and lots of thoughts. So the first thing I would do is I would ask your supervisor, I'm not sure who your supervisor is, your BCBA, I would ask them to assess what is going on with him. And I'm not talking about the traditional assessments that we do as behavior analysts. Whenever I hear someone misplacing things or losing things, my first inclination as a clinician is I need to rule out ADHD, because misplacing and losing things is definitely one of the symptoms of ADHD. It's a symptom, it's listed. So I'd want to have your child tested to identify if there's also ADHD issues, and if there are, we might want to have medication which would help him remember things and pay attention, and that might also help his learning. So that's very important. Secondly, if let's say that is ruled out, I'd want to look at having some testing done on executive functions, which have to do with planning behaviors. And then if there are some gaps in those areas, then I'd want to make sure that I'm working on those things, right? So that he's better at planning. A lot of kids have difficulty with planning things. And we have a whole series of lessons that focus just on teaching them how to plan an activity, especially when it comes to things like, school-related activities. So I feel like there's some assessments. Since you're a card patient, ask your BCBA to request a consult with Evelyn Kung. Evelyn is one of our oldest senior supervisor at CARD, and she is fantastic at really assessing children and identifying where the area of focus needs to be. And I feel like that is one of the things that would probably benefit right now, is just kind of focusing a little bit more on why is he forgetting things, what's going on. And in general, I will say whenever your child is struggling, this is a conversation you need to have with your BCBA. And, if your BCBA doesn't give you the answers that you like, ask to consult with a clinical director. We do have clinical directors at CARD who are all, 20 plus years of experience and have been with me for ages. And they are brilliant people who just come in, drop in, do a consultation, try to figure out what's going on. And they help our parents, I'll help our children, help our BCBAs, and give them a lot of ideas. So please ask for that.
There we go. Saying hi again to Judy and Amanda. So thrilled to have you here. Alicia and Jay and Taryn and Steven. I'm going to try to get to as many of these as possible, you guys. Alicia wants to know, do you think the ABA is a good thing? My son is on the waiting list. We need more help with potty training, feeding, and communication. He is nonverbal 11. I am almost 41, and we need more independence.
Yes. What were the requests? Potty training, communication, and what was the middle one?
Feeding.
Eating. Okay, feeding.
Feeding. Yeah.
Yes. So yes, ABA is a fantastic thing. ABA is a teaching technique, and it is wonderful when it's done right. So and when it's done right, you see progress. Now, I do want to kind of step back and say, just like anything else, when you first start something that is teaching you new things and is demanding, children will tend to want to try to avoid it because it's hard. But this is the only way that they learn rapidly. And as they realize, oh, this is going to be fun, I'm learning and I'm getting lots of reward, then they jump into it, and then it becomes like I always refer to ABA, good ABA, as a kind of the child's mode of communication. It just becomes their world, and they love it because they're able to communicate with all the folks that they work with. They're having fun, they're learning, they're moving forward. And so, yes, these are things that are very good. Now, it's also extremely important for your child at this age to have the skills that he's lacking, right? So toilet training at 10, I mean, that's a very, very important thing, right? It'll give him a great deal of independence if he's able to go to the bathroom by himself. So that's one. And yes, ABA programs do teach that. And communication, of course, nonverbal or verbal, it doesn't matter. We're looking at teaching your child ways to communicate his needs, ways to communicate what's going on in the world, how he feels, what does he see, what does he want, all of those things. They can be through OG devices, through sign, through picture exchange system communication, or vocal communication. And think about it, when your child learns communication, they do become not just more independent, but happier, because now they're able to express their needs to the world. And then they become more part of the world as opposed to being isolated and not knowing at all how to communicate with anyone. And then the third thing was feeding, which is so important, because not only do our kids become nutritionally deficient, this just becomes a nightmare over time. And yes, a lot of ABA programs have programs for feeding, very specific programs for feeding, which are very, very successful. In fact, feeding programs are one of the most successful programs in ABA. And through feeding, through these programs, an ABA special or a BCBA will teach your child how to broaden their diet so that they're eating different things, how to eat, appropriate amounts at each meal, how to tolerate different textures, all kinds of things. So I think it's really important that you do try to get into a program, an ABA program, and that you very specifically ask them to focus on these three things. At your child's age, you are going to be receiving what's called a focused program, and you've already identified three very important areas that need to be focused on. Now, depending on your child's challenging behaviors, whoever you talk to, a BCBA might say, oh, sure, I'm happy to do toilet training, but before I do it, I need to do a little bit of work on compliance, because obviously you don't want a child who is, let's say, aggressive. Trying to put them through toilet training just doesn't work. So there might be some prerequisite work that needs to happen, but they're going to do all of it. And I think it's vital for your child at this point.
Absolutely. I have to get to two questions that Marina had shared with us from your website. One of them was, I was watching through some old shows where I saw that you said sessions should be 2 to 3 hours, never longer than those hours. How do you get to 40 hours in that case? And would you mind giving a proposed schedule? Thank you so much.
Oh, sure. And that's, excuse me, great question. So the session length can be 4 hours. It shouldn't always be 4 hours. It can be 4 hours when you're doing maintenance work. So that means things that the child has already learned and you're generalizing them to the environment, or you're doing maintenance. So you're just checking on old stuff. So it's easy for the child. Otherwise, if you're doing, let's say, 2 to 3 hour sessions, it's not that you have to do one session a day. You do a session and then the child has a break and you do another session. So 40-hour programs are usually spread out over the course of the 7-day week, not just 5-day week. And the way that they are is that depending on when the child wakes, excuse me, you'll do, let's say, a 2 to 3 hour session with the child, let's say from 9 to 11, 9 to 12. And then the child will have lunch and have a little bit of a break. And then you'll do another session, let's say from 2 to 5. And you'll do that all week long. And you'll also do the same thing on the weekends. And you will get to 40 hours.
There we go. The other question that we had came in, this is from Saudi Arabia. This person says, I'm 26 years old and I've been stuttering for more than 10 years. I underwent medical examinations, brain x-rays, chest x-rays, all results are good. What are the causes of stuttering? Is it psychological, physical, or a neurotransmitter problem? The result of the chest x-ray was excellent, but when I speak, I get tired quickly. What is the reason, and do you provide your services worldwide?
Well, these are great questions. Okay. So stuttering is actually a very interesting thing, and there has been research that shows it could be neurological, but it could also be related to anxiety. And someone needs to identify that first. And the way that we do that here in the US is that you would do a series of neurological tests and even maybe brain scans to identify that there's not some underlying seizure activity or something else that is causing this behavior, right? Once you've done that, once you've ruled that out, then you're looking at possibilities of, is this just anxiety related? Is it a language disorder? Is it something that is connected to Tourette's? There are lots of different things that could be causing it, but once you've kind of identified that, then there are interventions for stuttering that can be done. They're not necessarily under the realm of just behavioral interventions, but there are definitely cognitive behavior treatments for stuttering, and that have been very effective. And Shannon, I can actually look them up and send them to you if you want to send them to this individual.
That would be great.
But the thing I wanted to say is at the end, the individual brings up the about breathing and getting tired. That I've not ever heard breath being related to stuttering. So that concerns me a little bit, and I would really want to make sure that you are getting the oxygen intake and that there's nothing going on. And I think they said their lung x-ray has been normal.
Yep.
So I'm just, I don't know anything else about your physiology. I don't know what your weight is, your cholesterol levels, your heart functioning, all that kind of stuff. But I would recommend that if you feel you are out of breath and also getting tired, you do need a full physical to figure out why that's happening. And I don't know that that's necessarily related to the stuttering, but I definitely recommend that you get a full physical to figure that out. Okay, now whether or not we provide services, it's interesting actually that I was over the last several years very involved with helping people in Saudi Arabia. There are a few really good centers in Saudi Arabia, and Shannon, we can recommend some of those when I send you some names as well.
Fabulous.
And I would recommend that you go there and actually see, depending on where you are in Saudi, the ones that I know are in Riyadh. And I'm sure there are exceptional people there who can help you.
Okay, wonderful. Taryn wants to know, hi ladies, my son just passed the, I'm probably not going to pronounce it correct, the Battelle 3 test to enter kindergarten next year. He has been in full-time ABA for 2 years. What do you think of that test? It's BATTELLE.
I think this is I'm just looking up right now. I think it's an achievement test because this isn't a test that we use frequently, but I don't know enough about it to tell you, but I think I've heard of it, and I think it's a achievement test, which should be able to tell you more about kind of where your child fits into school. But honestly, I shouldn't be commenting on it because I have not seen this test or administered it myself.
Okay, but there you go. Steven says, hi everyone, my son is 7 and doing very well at school. He is starting to complain about the extra hours I spend with him doing math, reading, etc. Should I continue to push him? I'm fearful of relaxing.
I mean, I love it. This is such a normal parent's problem. You know what I mean? It's like all of our kids, no matter what they're struggling with, complain when we force them to do additional work, right? So I think this is something you need to balance out. Does he need the additional tutoring that you give him? Or would he do fine without it? And also, do you need to be the person actually doing this tutoring? And if you come to the conclusion that it isn't necessarily great, take a break, it's good for you, good for him. If you do come to the conclusion that he needs this additional tutoring, then you can certainly continue to provide it as long as you increase reward for him and for yourself. Like make it more fun, reduce the hours maybe, do more breaks in there. Or you could get help from someone else, like a professional tutor, or ask the school if they can offer you some help. That way he's continuing to get the help, but you're also getting a break. And I appreciate that you wrote it's hard to relax. I think that's such an important thing for parents that we are so committed to trying to help our kids in one way or another that we don't pay attention to our own needs. And being able to relax is important because the better you feel, the better parent you're going to be. So, try to get some help. That's always what I say. Try to get some help.
And I love Khan Academy. Talk about help. KHAN Academy. It's free and it will teach math and reading to your child. You can be taking the class side by side or you can just monitor, and it makes it fun. And my favorite thing about Khan Academy is it teaches it in really fun, very kind of YouTube-y sort of ways. They watch a video and then they get to try it out in an experiential way, and then they gain access to a world where they can build something with it and have other people watch, share, and build on their thing. It's awesome and it's free. So Khan Academy, just saying. And they pay me nothing. Where's the sponsorship money from Khan Academy? All right, onward. Ajitha has written in and said, hello, doctor. Can we allow a 5.5-year-old to watch YouTube videos if he has the control and likes to watch specific video a lot?
Yes, you can. That's a great question. Thanks for asking that question. I never want to deprive our children of their reinforcers, first of all. That's kind of important. It's like we all have things we like to do. I was talking to my son last night, and it was like, I think it was around 9 o'clock at night, and I said, I was getting into a subject that would have taken long, and he's like, I only have 5 minutes. And I said, why do you have 5 minutes? And he said, I have to get online with my friends. And he's 25. So I know that that is like a social reinforcer for a lot of kids to be able to spend some time on YouTube or whatever it is, right, that they're doing. I don't want to take it away. You just want to make sure that if your child is obsessing or that becomes such a overarching or over-encompassing activity that it takes over everything else, you control that. It's like anything else. We're teaching our kids when they're young how to self-regulate. And when they're hopefully 25, then you don't have to worry about it because they're never going to stay up until 3 in the morning and miss work the next day, right? Because they've learned to contain that reinforcer. But what you want to do now is you want to teach him, vary the things you're watching, because or if he wants to watch the same thing, that's fine too, but at least limit the amount of time, because we don't want to have that becomes the same thing he does every single night for 2 hours a night, and then that starts to really affect his thinking and his communication ability. So as long as it's limited, it is a powerful reinforcer. Use it as a powerful reinforcer. So, maybe if you want to limit it, you'll say, days when you've done A, B, or C, you can definitely spend an hour watching YouTube. Just like anyone else, any other child, this is what we would do. Set rules around it, but allow it because it's important to our kids.
All right, we have 2 questions left. We're over time. But do you have 3 minutes and we could bang them all out, or you got to go?
Sure, why not? Sure,
Okay.
no, go right ahead.
Sarah wrote in and said, do you think when children start acquiring higher language skills, their progress seems to slow down as it becomes more complex, or does it vary from child to child or teaching methodologies? Because Sarah's got 2, and I know they've been making huge progress, but it sounds like maybe things are slowing down a little bit.
So it is common for kids to slow down on the higher functioning stuff because it's just harder. Cognitive lessons, abstract lessons, those things are harder to master than just rote learning. So it is common, and we do expect a whole different rate of acquisition at that level. But some kids will just figure it out and keep going fast. If you find that your child's struggling, make sure that there's enough prompting, modeling, there's enough help, and a lot of reinforcers, because you don't want your child to kind of give up at any point, no matter where in the curriculum or lesson plan they are. But it is a common thing just because it's more abstract.
But don't let it stagnate, correct?
Don't let it stagnate, and don't let it become aversive for your child. That's what's more important.
our fabulous Amanda, who wrote back earlier and said, by the way, it's a very, and I've seen this too, these sleep consultants and feeding consultants are popping up everywhere. But she wants to know, what about the ATEC scoring model? She says, I've been using it to base my son's progress. Do you like the ATEC scoring model?
Yeah, the ATEC is nice, and actually it's been validated, and it was Shannon. It was developed by Steve and Edelson at Autism Research Institute, and we actually at CARD validated it for him. We did the validation study, so I know the ATEC. It is valid and it is very respected. It's based on subjective opinion, right? It's not a direct test. It's a questionnaire. So, but it's not bad in terms of just keeping track, and it's easy enough to be able to use as an ongoing thing. And I don't know, it doesn't cover the higher level stuff. There are other questionnaires that are just as good or even more detailed, like the Vineland Adaptive Behavior Scale, or the PDDBI. There are lots of really good questionnaire format tests. Might take a little bit longer than the ATEC, but they're great to do every 6 months or so and see how your child's progressing.
And it's all going to be moot because very soon, Amanda, you're going to be able to use skills and it's going to show you exactly. And you're going to lose your mind. It's going to be so much fun for you. I'm so excited. Dr. Grant-Pichet, first of all, thank you for this hour. Happy Valentine's Day. Thank you for your work.
Too. Thank you, Shannon. Thanks so much, and happy Valentine's to all of our viewers. It's lovely to do the show. I'm glad I was able to do it from home today. Thank you.
Absolutely. So glad that you could. And just a programming note, no live show tomorrow. So we're back on the air on Monday with just so much exciting stuff going on, you guys. And we'll be back next week, next Tuesday, with Dr. Grant-Pichet for Ask Dr. Doreen. So until then, please, happy Valentine's Day, everybody. And give your kiddos a hug from me and one for you, too. Bye-bye for now.
Bye, everyone.
If you found anything helpful in this video, please give us a like. In fact, make sure that you smash that subscribe button on YouTube and give us a like on Facebook. You can also follow us on Twitter and on Instagram for important updates. And please download our free podcast wherever you get your podcasts. Thank you so much. See you next time.